So I'm curious can you talk a little bit more about the difference in the DETR funding and how it comes to you? So if we're already a DETR approved trainer, can we apply to you as well?
Yeah, so that's a great question and complex. So let me address all those points. DETR currently receives 7, if you will, or administers 7 of those 17 WIOA funding streams that you saw on the screen. And so you might be a partner of DETR in any of those other funding streams, and that's fine. That doesn't exclude you from being a partner of ours or a subrecipient of ours for the Title I, which is separate from the other 7. So so I think that's, I wanted to remember the word. So Terry also used the word training provider. And that's kind of a complex subject as well, because in this world, what we're talking about today is the provision of services that don't necessarily mean that we expect you to be a training provider. There is a list of training providers that the funds we give you can pay for those services. And so again, we can get into more details about that later, but the short answer is no, it doesn't preclude you from being a subrecipient of ours if you're a subrecipient of another one of the administrators. Thank you, Terry. And the staff, please just make sure you guys, the staff, no, sorry, the staff jumps in whenever I am wrong. I'm depending on them to say no. So, yes, sir.
This is a great question on whether or not I can get a copy of the deck that was just provided.
Yes, I think the short answer is yes.
Okay.
And that would be available later today. So if you please leave us your, and also again, I can't remember, welcome to those of you who walked in late. If you missed some of today and your schedule allows, there'll be an identical session later today at 2, I believe, but the deck is another way to get it. And after looking at the deck and attending the next, after the RFP is released, the Mandatory Bidders Conference is another great opportunity to ask any and all questions regarding this process.
Jaime, this will also be available online once we're done. It'll be put up for anybody to see on the website.
Oh, perfect. There you go. Yeah, awesome. Next question. Yes, Vicky.
Yes, there's an online question. Can you be a for-profit company to apply for the funds? And also, the other question was, do you have a hard copy of the presentations, which was just answered?
Perfect. Thank you, Vicky. That's another great question. And if you haven't noticed, this is the first time we're doing this style where we have people joining us remotely from the outside through audio video so they can see what's happening. We're testing it because we intend to do that at the Mandatory Bidders Conference as well. In the past, we used to make everybody come physically here. And we think with the advent of today's technology, that's not needed. We have seasoned providers who have been here year after year, and so they can attend from their office if they so desire, and so can other people across the nation, really. So the answer to the question is the copy, you said yes, and then if you are, the legislation does not exclude a for-profit company from applying. There's actually a list of allowable agencies and for-profits are included and allowed to apply for the funds, yes. We have another question here in the second row.
Thank you. Is there a detailed process for becoming partners? Or will that be more detailed in the RFP? Or is there a preferred process even locally?
Yeah, thank you for the question. So this is, you actually have joined part of that process now, right? Your interest is the first step. And then, of course, participating through these, this informational workshop, the next step, which is mandatory, the bidders conference, you get to put your name on a list that says, I intend to apply to be a subrecipient. We call it funded partner as well, subrecipient. And so and then the end of that process is an award of a contract. And that's when you officially become a subrecipient if you're awarded. May I clarify? Absolutely.
Just to clarify, I actually meant if you wanted to partner with other nonprofits.
Oh, yeah.
If there is a.
Great question.
Thank you.
That's another reason why you're here today. This the mandatory conference is to kind of know who's interested in this process. Sometimes consortiums are built because agencies have strengths that others don't, and so they complement each other. I think later today, if we haven't said it already, you'll see that when they apply, there must be one lead fiscal agent that is responsible overall for the contract. But yes, many times you see partnerships formed, and so today, just exchanging cards, meeting people, hearing the questions that you see today, and at the Mandatory Bidders Conference gives you a good idea of who would be a good partner. The list of attendees, I believe.
That was my next question.
Can that be? Is that going to be made available? I'm looking at the staff, the people who attended. Yes. So, yeah.
Yay!
I want to make sure I'm not getting in trouble, but yes. So there'll be, again, because you don't have enough time to meet everybody, there'll be a list of attendees in case you recognize an agency that you thought, oh, wow, I really would like to talk to them. Then you'll have an email or a contact. You can reach out to them and, discuss your interest. I like to, I know I just saw him, and who here is a boxing fan? Anybody a boxing fan? All right. So I just saw him walk into the room, I've always wanted to do this. In the red corner, from Oxnard, California, the ferocious Fernando Vargas. Yeah, look at that guy. Welcome, champ. Yeah, world champion. I used to watch your fights. I don't know how you stay in that pocket so long. You're so courageous. Oh my gosh. All right, I'm gonna get an autograph later. Thank you for your interest. I know you're doing great work in the community with your foundation and youth, so welcome. Who was next? Oh, Vicky. Okay.
Will you be going into more detail today about performance measures for adult and dislocated and out of youth programs?
Please repeat that. When it said when, or
will you be going into more detail
about
today?
How much?
About performance measures.
Oh yes. Okay. Thank you. So yes, I think we briefly touched on the general performance metrics for the 5, which were, of course, placement and employment second quarter after exit for the adult. And then on the youth, it doesn't necessarily have to be only employment. It can be placement into education as well, or post-secondary activities, because being placed into the military counts, being placed into an apprenticeship counts, being placed into HVAC school counts, and so on. Yes, I believe we'll be going into more detail, not only today, but also during the Mandatory Bidders Conference as well.
The RFP document also contains a lot more information. So a lot of your more in-depth questions will be answered in that document, and those questions with more detail will be great for the Bidders Conference. So definitely hold those for that time.
There you go. Thank you.
Good morning, Jaime. Cherie Johnson here. How many different organizations are you awarding these funds, and what types of organizations? Like, are you doing one nonprofit, one for-profit? What's that look like?
Great. So currently our board or our chief local elected officials, which are 2 bodies of governance, we have never had direction in that sense of saying you must choose one or the other until now. And I haven't seen any direction again for change. It's always been the applications. Let's say 20 applications come from the group. The process has always been, I think, and so far it will continue to be, the top applications according to the budget. If we only have, in this case, we have $18 million to award, the highest thought of, or the applications that the board feels are the best ones to match our need, when that reaches 18 million, that's when we stop. And so it won't go beyond there because we have no funds. And I'm scanning across the room. I just saw one of our board members over there. I'd like to acknowledge her. Hi, Jill. Jill Hersha, representing Title II, is here, and she's one of our board members. Am I correct in that, the direction of the board? Okay. Thank you for being here. Okay, next question. So I wrote down one, and maybe this guys will give you. I said, if I'm new here today, there was a moment where I heard somebody said, you might not receive all of the funds if you, don't spend them. And so could you, Marianne, explain that a little bit more? If I apply for $1 million, and why wouldn't I get the $1 million?
Great, that's a great question. So like I said before, we have cost reimbursement awards. So these differ from grants you might have received before, where you get a defined amount of money, sometimes up front. So this is different from that because you only are reimbursed for your actual expenditures for your program. So you might have $1 million award, and we really do want you to spend it all. So we don't have any interest in recapturing it. But if you're not able to spend it all, especially if you're a brand new provider, it can be hard sometimes to get adjusted to everything. So if you don't spend it all, then we just recapture it. We put it back into the pot for our next year's funding. Okay, is that clear?
So recapture doesn't necessarily mean that you gave me the million and you have to come recapture it, right?
No, sorry, it's not a grant. The feds don't let us just give you $1 million and trust that you're going to spend it properly. So we dole it out as you expend it. We reimburse you for your expenditures. And then if you just don't get a chance to spend it all, then we just put it back into the pot for next year.
And the when you say reimburse, what does that look like? Do I pay my staff for the last 30 days and then I send you an invoice for that?
Yes, you do.
All right.
And if you become one of our subrecipients, we do a lot of training. So we talk to you about all this process, how all of these things work, how you get your funds and everything like that. So we have very defined processes for all of this.
I think my acting got me a question over here. I see the microphone.
Yeah, I think, so my question is, do you also monitor the levels of spending? So if you have a grant for a year, let's say, and you got 100,000, and presumably you spend 25,000 per quarter, right? Do you monitor that so that the spending and the investment in the community is immediate and not in the last quarter?
Sure, of course. So we work with all of our subrecipients. We have decades, and when I say decades, I mean decades of experience working with these funds here. So we are interested in helping you all to be successful. We really want the funds to be spent so we can maximize that impact in the community. So we'll work with you. We monitor everything all the time. So we have lots of staff here to work with you on all of that.
For this cycle funding, are you guys going to have the funding for the RFP individually, or how are you going to release the dollars per the contracts?
Yeah, that's a great question. In the past, you have seen us release, I think, RFPs with certain numbers, meaning the 18 million pot that you just saw on that flyer in the past would be divided up. So you'd say, you would see 6 million for this. It could be even a specific target population when it said $1 million to specifically to serve vets, or $1 million specifically to serve people exiting the prison system. We call that reentry services. And so as you can tell, this time we haven't done that. And so next Wednesday you'll see with more detail, but that is a little different this time. We just felt that in the past, and this is something, again, our board, Jill and her peers approved, and also the chief local elected officials, we felt that it hadn't worked best for us when we put together contracts that were limited, if you will, or focused on just one thing. I know there's exceptions to that, and there still will always be, but really when you look at the legislation and you look across the country, what they're trying to do is make sure that these centers have subject matter expertise to serve all the populations. And so our desire would be that the contracts there are in these centers, along with the other partners that you saw there, Title 2, 3, 4, that the Title 1 contracts would be able to serve all those multiple populations. If somebody walked in with a criminal record that they needed to get back to work, they need to be served. A vet, a returning vet, a person with disabilities, a foster, a youth exiting the system, any of those. And so I hope that answers the question. You'll know more on Wednesday with more specificity about how you could shape your proposal, because that, again, I think that's going to give you a little bit more flexibility than you've ever had to design your program. Yes, over here on the, oh, 1 second, sir. So Vicky, go ahead.
Does being a current provider of services establish preference for future funding?
That's a great question. That must be an established service provider answer, huh? Online. So, I mean, the simple answer, if you could only have one word, would be, no, because it's a fair, competitive process. Again, where we're looking for the application that best meets the need of the community today. And so it could be that an established provider's proposal does not. It could be that it does. And so I think it's not a guarantee. I think what an established provider has going for them or not is their established and demonstrated ability to meet what the law requires, right? So if the established provider for the last 10 years has overwhelmingly exceeded the expectations, that I would have to guess that's a positive. But if the contrary is true, then at the same time that could not become a positive. So that's a great question. Yes, sir.
It sounds like this is a very innovative program. I'm curious to know whether or not, where's the precedent? In other words, has this been used someplace else? And can anyone speak to what has happened with that particular program,
Sure.
that particular place that might have actually used this program before?
And when you say the program,
This entire,
okay.
yes.
Okay, I'll try to
exactly.
address that. So Title I services as part of WIOA, again, that big picture. Can we go back to that slide where it shows the 17? I have the thing here, Brett, I'll let you drive. We, again, keep this in mind that the 18 million that we are announcing an RFP for are part of more of a $120 million pie that we have here in Southern Nevada. And it's those other agencies, as you saw, that administer those funds, those other funds. Sometimes the state agency themselves administer it with state staff, merit staff they called it, and sometimes they do, like us, seek subrecipients. And so that whole system, that one-stop delivery system, has been in existence in one shape or another for almost 30 plus years now. Before what's called today the Workforce Innovation and Opportunity Act, which was signed into law by President Obama in 2014. It was the predecessor legislation was called the Workforce Investment Act of 1998. That was signed into law by President Clinton. And before that, it was the Job Training Partnership Act, or JTPA, and before that, CETA. And so it goes back, the program itself goes back a long time. But what is unique and new, I'm glad you saw that, is that in the past, at least here in Southern Nevada, there has not been a strong focus in trying to braid all of these funding streams together. And that's exactly what the legislation calls for. And again, I think as Brett opened it up, it calls for that happening within the context of these American Job Centers or one-stop career centers. So what is new is we're saying now, we've started 2 years ago in this role of convening this system. We signed a memorandum of understanding between all of these partners. Oh, I'm sorry, I keep walking away from the mic, huh? Thank you. 2 mics like that. We have them all sign a memorandum of understanding committing to that process. We also are called on as a board to make sure there's an infrastructure funding agreement, which has to do how do we share our resources. And what we intend to do now and what's new is we really intend to push forward to make sure exponentially we get better at making sure that the Title I, the $18 million that we are RFPing now, works as closely and as integrated as possible with all of the others in the context of that system. That's a great question. Yes, sir.
So the release is on Thursday.
Okay, so clarification that the release is on Thursday, November 8th, not Wednesday. I must have said Wednesday. See, I knew my staff was going to correct me eventually.
Just a quick question about the KPIs. I heard earlier that there's a 12-month follow-up KPI. It seems like it's an important KPI. Is that something that the subrecipient should include in their budgeting, or is that something that your organization, government, does?
So KPI is key performance indicators, or?
Yes, so your phrase was metrics, I think.
Yes, okay. So we'll learn more about that, I think, not only today, but in the mandatory bidder conference. But let me make sure that I've heard you. The metrics that the federal government gives us in this framework is non-negotiable, meaning that they say the funds, when they're expended on a group of 100 people, this is what your targets has to be. Meaning they don't give us the flexibility to say, you can train them for jobs that you thought, occupations that you thought might be good, but then you were wrong, and so the 100 people don't get jobs. That's just not right. And so they expect that when you engage in these training services for 100 people, that a certain number of them finish the training, a certain number of them enter into that employment based on the training, that the wages for that training be, good wages, that and that's obviously going to be reflective of the credentials they earn, the skill attainment that they earn, and then more importantly, after Q2 and Q4, they're still employed. So that's what the outcomes are. Now, I think your question is really good in another sense, because that's the minimum. That's the minimum that we have to meet. But proposals, when they're evaluated by our board and our LEOs, if people who exceed that are going to be, looked upon, oh, wow, this group, this agency is saying that they have the types of employer partnerships and established demonstrated ability to place people at $20 an hour jobs, and and hundreds of them. And this other agency is proposing to me to use the same amount of money to try to train, the same target population, and they're only going to place half of it at half the salary. And so I would say that meeting the minimum is great, but and of course in this process, adding improving on the key performance indicators, and perhaps even adding some of additional ones that raise the return on the investment is a good thing. Okay, so we're gonna go over there, and I see messages from my staff. You decide who has the question.
I was gonna say online.
Online, okay, go ahead. And then I also okay, I have a sign that we have 10 minutes left before we have to start the next round. So keep in mind, there's another round of questions coming up. Vicky.
Okay, on to the next question. Are WIOA title funds restricted? That's the next question.
So that's pretty generic, right? But they are restrictive, I have to say. I mean, generically restrictive. There is room for innovation in there, and that's why that word is in the law, Workforce Innovation Opportunity Act. But it's a framework. If you were imagine, I'm gonna stay right here. If you imagine that big rectangle on the wall as being the parameters of this legislation and what you can do with the money, where you can't be is here. And buy something you can't. But there's rooms to come to the corner and be innovative. And so again, that's a very broad question that we can spend a lot of time on. I would say again, think about the limits being hard, and think about that's the federal limits. I think what happens a lot of times is I think you heard it earlier, the state has the opportunity to draw closer parameters so they could make the rectangle smaller, and so could we. But our intent is not to do that. So that's the best I can do with that answer.
I can piggyback just a tiny bit, just for a little bit of clarification. So I had mentioned in the presentation before, our policy online lists what costs are allowable. So we highly encourage you to go online and look at those. So in some ways they can be restrictive, but in other ways, as I mentioned earlier, these funds can cover things that other grants will not. So, you have to go online, kind of familiarize yourself with what the allowable costs are, and then you'll see exactly what these can be used for.
And I wanted to add too, if your agency is awarded these funds, as Marianne said earlier, we will do extensive training. So we're just not going to turn you loose and let you rack up disallowed costs. We're going to help you.
That's good. I saw another hand. Oh yes, over here.
Can I do one more?
Another online. Let's not forget about this question over here.
Is there a maximum dollar amount limit per request? Also, can you apply for more than one program? And if so, do we submit one application per program or one application? Also, what is the maximum percentage of the total program cost that we can request?
Okay, that's a great question. Several questions, right? The simplest way to answer it is there'll be a lot more of that answered in the RFP when it's released. But let me tell you again, logically, if you think pragmatically about it, the pie is only 18 million wide, right? And so if we had a proposer come and say, I want the 18 million, that's a big ask. And especially if that proposer was only going to concentrate on, this population, and he or she asked for the 18 million, then that means we we don't have anything for the rest. So again, there'll be more on that in the RFP, but it's very obvious that the 18 million has to spread across the valley, has to spread across the locations that you saw there mentioned on the screen. And so again, more to come on that piece. But there was something in there, Vicky, that I wanted to address about, quickly tell me what it was again. Percentage, amount. Oh, I know. Yes. Yeah, I addressed that, but also there was something about, do we have to have multiple applications, right? Yep. So there'll be, again, things that will come clear next week about whether you need to submit, depending on, you know, the centers that you saw on that list. They'll become more clear on whether you have to or want to submit just one application or multiple ones. That's coming up, that detail. Okay, yes.
Do you have any regulations or thoughts around cost per client? Because I know that was something that was existing in the past.
So I'll let, how about staff take the past piece and then I'll go forward.
I would say in the past, we've traditionally had a very low cost per. As the economy has improved, we're serving a different client pool now with more extensive barriers. So we are looking to increase the cost per at this point in time.
Yep, and I guess I'll add to that. I would say I agree completely. We have not been told by our board members or our chief local elected officials, there's a number you need to hold to on cost per. I think what we've heard loud and clear from them is, and you know, you cannot continue to do the same thing when you have a different reality, right? So in other words, today, the unemployment bucket is almost empty. We're in what they call virtual full employment, where the great majority, if not all of the people who are ready to work and willing to work are working. And so we have to, not just this is across the nation, we have to really focus on what they call alternate labor pools. So not just the unemployment bucket that it used to be plentiful and you can go get accountants and nurses that they're ready to go to work. Now we have to look at, again, the all these other pools, right? And they're good pools. I think we just heard from a company, Sephora in North Las Vegas, who actually wants almost half of their workforce to come with people with disabilities. And so, you know, that's a great pool of resources. The vets are a great pool. The reentry population is a great pool. The youth that are 18 through 24 today, and for whatever reasons, ABC have a much higher unemployment rate compared to the rest of the population. That's going to be a huge point of emphasis for us moving forward. And in addition to those pools, the underemployed. For the last 2-3 years, our service providers have been putting people into work at $8, $9, $10, $11, $12 an hour jobs, which is great to enter the workforce. But the expectation would be that now maybe it's time to take those and upskill them so they can move up the career ladder to 14, 16, 18 to be able to support a family. So I think if there ever was an appetite for a higher cost per and for increasing the quality of the work, even though the quantity would suffer, it would be now. That's a great question. Irene, how are we doing in the 10 minutes? 2 minutes left. Okay. Dr. Cantu.
Good morning. My question has to do with the eligible training provider list, or ETPL. So, you know, I've always worked here in Las Vegas and know that you can refer people to training programs here. But when it comes to outlying areas of Clark County or Lincoln or Nye, are there training opportunities on the ETPL for youth or adults out there?
That's a great question that probably exposes something we have a lot of opportunity for improvement. The good news is that we have, I think, made huge strides. There's a new president at CSN. I think you guys have all heard his name, Dr. Federico Zaragoza. And so we are working to improve exactly that, Renee. And so again, I would say in full transparency, that's one place we can do better. Questions. I made a couple of notes here that I think if I was you in your seat, I would be thinking about, right? The next step, as you know, one of the next steps is this bidder conference we keep talking about being mandatory. So again, we're making it so that you don't have to be in here in person. There is that virtual attendance option. So I would just be, you know, again, careful, right? If you're really serious about this, I'd have a plan A and a plan B, you know? So anyway, that's, I guess, the best I can say without, doing it for you. But yeah, great question. So what are the hours on that day? I believe the bidders conference will start at 10 a.m. And again, you'll see next week the actual RFP will come out, and that will be documented in that as well. When the bidders conference, what time, and all that. So the other note I made here for you is turning in the application. Same thing. The bidders conference is a day that decides if you're here or if you're not here, it means you can't move forward. There's other steps along the process that do the same thing, like not turning in the statement of qualifications is something that kind of ends the process for you. Another piece down the road. So again, make sure you do that. And along with the statement of qualifications, the actual application, I personally would not wait until the last day to turn it in, right? We heard about traffic. Like I just can't envision myself driving at, 1:30 with the application. And so I would say I used to, in full transparency, I used to lie to my kids about deadlines. I used to like move them forward, and they would stress and stress. And the day of, I remember one time my daughter was crying, I wish I had one more day. And so I said, guess what you do? And I taught them this lesson of, that might be the deadline, but you set your own deadline, and then you have that cushion. So anyway, I would say, kind of do that. Don't leave anything to chance. Give yourself enough time to make a mistake, to have an accident. Hopefully you don't. But yeah, give yourself enough time. So those were my thoughts. So I'll open up for Dr. Cantu.
Sir, my question is with regard to, I have a sense of beginning and ending. Obviously your bidders conference is on the 15th and what is this, November, and launch July 1. Is there a rough sketch of what, the other key dates in terms of, the deadline, and in terms of the review, and when the announcements will take place in the spring, that kind of thing?
Yeah, that's a great question. And, obviously that shows hunger for information, right? And the staff, I hear them, we've been working really hard, and we feel that the dates are 99.9 locked in. And so, I mean, if we could, again, you'll see them here in a week, but that timeline, looks like it almost always has looked where November is information, like you saw now. It's the release of the RFP. It's the bidders conference. That's November. Then you usually have, all of December and most of January to write your applications, and hopefully, again, those of you who are seasoned and established providers, of course, have a lot to draw from. But those of you who aren't, then again, there's a wealth of information out there for you to go. It might be that you're somebody who's worked with other types of federal dollars or state dollars or local dollars. The partnership idea that I heard around here is really good, I think, and encouraged. And so after that, there's a period of course, after you turn in applications in the beginning month of the year, there's an evaluation period, which lasts, 30, 45, I think 60 days, where we have external evaluators participate in that evaluation process. Then staff will gather a selection, group or panel that will also evaluate. Eventually, though, as those of you who are familiar, it gets to the actual programs committee members and to our board members and to the members of the local elected officials consortium. They are the decision makers for this. We as staff guide the work, guide the evaluation process, but it is them who are called upon by the legislation because of their subject matter expertise and their fiduciary responsibility. They are the ones that vote and say, we have 18 million and we can't fund all 20 applications, so we're gonna fund the top, 7, 8 that add up to that number. But it's that happens in a public setting as well. That sometimes it's fun, sometimes it's not fun. Good question, though. Do you see one, Faith? Oh, you're online. Okay, this online thing is kind of fun, right? It's like a you don't see them, but you can.
In regards with partnership and collaborations, are there any programs available for educational training for youth who are involved in juvenile justice system?
Yeah, that's a great question. again, the simple answer is yes, right? Because the legislation, the work calls upon to serve those with barriers to uh, obtaining their education and entering employment. And of course, that's one form of a barrier. When you have, when you're in the juvenile justice system, you need opportunities. And so these programs can be designed to target those particular populations. Like currently, I think we have a program that addresses youth in the Spring Mountain Camp. Is that right? So that's part of the juvenile justice systems here in our area. And so definitely youth with barriers because they're in the juvenile system, with barriers because they have disabilities, with barriers because they're either in or are exiting the foster youth system. Those are all the youth that we hope that the program design will be targeted towards. Good question. You have another one, Vicky, online? All right.
Based on the previous announced funding amount, how many projects are you planning to fund? And are there out-of-state entities eligible to apply for these funds?
I'll start with the second one because before I forget it. And yes, I mean, I think, again, the law does not restrict who can apply for the funds. Not only is it for-profits, nonprofits, state agencies, local agencies, governmental agencies, but also in-state, out-of-state. And, I haven't heard of international yet. I haven't, at least in my mind, it's not there. Next time I go to NOB or these meetings, I'd like to maybe ask some of those questions. Has there ever been an international company? But the other question is obviously the one we've heard a lot today, right? How are you going to land on a number? How many contracts, right? We just don't know that because, all of that still has to be seen. It could be, remember my example again, if we have 18 million and there's 20 applications, and let's say the first application asks for 18, again, it's going to be very unlikely that we settle for that the board and the LEO settle for that one provider, especially if it doesn't address all the need, right? If the ask is, I want all the money for one of your 5 things, then most likely it's not going to happen. And so, again, that all has to be evaluated. Eventually, I think proposals need to be adjusted, negotiated. So, I don't know where we'll land on the number of contracts. What I do know is that we only have $18 million. We know very clearly the need of our community today. It's very evident through the labor market data. And we know that the desire, again, of our board and our LEOs is to make sure that these funds are not deployed in isolation, just as Title I funds, that they're deployed in the context of a one-stop delivery system that braids and leverages Title II, Title III, Title IV, SNAP, TAA, and so forth. And so that's the one thing we know for sure. How are we looking? Ooh, you seem all satisfied. I mean, everybody's good, huh? Another one online. All right.
There's like 3 more.
There's 3 more. Okay. All right.
The individual that asked previously about a question wants a clarification, I guess.
Okay.
She asked previously, what is the maximum percentage of the total program cost that they can request? So she needs a clarification.
More detail on that, right? So of the 18 million, how much can she ask for?
To clarify, what percentage of our program cost can we
So I say the best answer to that is next Wednesday or Thursday when the RFP is released, she'll have a much more clarity and information about that. We have it very, very prescriptive, a lot more detail on that. I believe that question will be answered. Today's workshop or informational workshop was really tailored around what are these programs, and then if you're interested, how do you apply? Really, the next steps will be handled after that you see the RFP and you attend the mandatory bids conference. That's the kind of question we'll be dealing with at the mandatory, because you'll have the your instructions there. And I think at that time, you'll be able to say, hey, how do I, and so I think that question will be best answered after they see the RFP and attend the mandatory bidder conference.
Okay, so Is there an one-stop operator in place? That's the next question.
Great question. So the answer is yes. We procured the operator function here in the system almost 2 years ago. I believe they're somewhere in the second year of the contract. Is that right? I'm looking, yes. So they're somewhere in the second year of a potential 4-year contract. Again, all of our contracts, because of federal law, can go up to 4 years without a new procurement action, meaning we don't have to do this every year. We can do it every 4. Given that, those who receive the money, of course, well, first, that there is money, that the money comes here. That's number one. And if it's here, that when we give it to the service providers, that they perform, exceed the outcomes that they committed to when they applied for the funds. And so given those conditions, we can extend contracts beyond the first, second, third, up to a 4th year. And so the operator is right now in their 2nd year of that contract.
And this was already asked, but how long is the application process from beginning to approval?
Yeah, that's really good. I think, again, this is a rough estimate. If we say we started today with this informational workshops, November 5th, it could go, again, I'm going to say the best scenario. The best scenario would be that, you all submit, the evaluation process happens, and somewhere in March or April, the final step of approval happens through that process I told you. Our program committee members, our board members, our LEO members select and approve who gets awarded these funds, which agencies, and then that leaves us a couple of months, if you will, to negotiate, draw contracts for a July 1st start. But we also have a cushion built in there. So if that happened, it'd be November, December, January, February, March, April. So like a 5-month month process. But if we have a cushion built in, so for whatever reason something doesn't go perfectly, there is another meeting that we can go to, or another cycle of meetings where the selection could happen in May, hopefully May, if not June early, so that again we could negotiate contracts and put everything into place by July 1st. So in the worst case, 6-7 months, in the best case, 5-6 months is the whole process. And I said it. Does everybody here, show of hands, who knows the difference between the role of the operator, the one-stop operator, and the role of the Title I service provider? Show of hands, who knows that? Half the room. So I think it's just important that to say it in that context of that picture. Again, Title I service providers, which you're here interested for, receive the great majority of those funds from us, because that's the function that pays, again, for the career coaches and the staff that's in these centers, meeting one-on-one with these clients that need help. The operator function is kind of a unique and different function in that they are called upon to coordinate those 17 funding streams in these centers. So as staff, the law kind of calls us to be hands-off and not get in there. We, again, are overseers of the system, the fiscal management, the strategic direction. We write the plan. But the operator gets paid to coordinate the seamless delivery of those services in those centers. I think that's just important for you to know as you move forward, write your proposals. Those of obviously half the room knew exactly what the operator does. So very good. So we're rounding the corner. It's 10:02. Oh, I see a question. I'm sorry, Jennifer.
Good
hi.
morning, Jaime. Can you talk a little bit about the administrative costs, what's reimbursable, and maybe that'll be more detail in the RFP, but if there's a percentage or what that looks like?
Absolutely. The fiscal team will be glad to talk about that.
And it absolutely is, of course, outlined in the RFP in more detail. So we highly encourage you to take a look at that. Again, on our website is our list of allowable costs. You'll get a lot of your questions answered when the RFP releases, and bring additional ones to the bidders for sure.
Who knew you could be so excited about fiscal as Marianne, right? Here's the good news, though. I mean, if you hopefully get awarded the funds, know that you have somebody that's dying to talk to you about all your fiscal.
I love it. Can you
questions
tell?
moving forward? Yeah, that's an awesome thing. I'm seeing. So let me ask this question. I know we have, again, thank you, Jill, for sitting all this time here with us as a board member. I'm sure you'll be able to go back to the board next time and share what you saw, the interest in the community about, half the people experience, half not. People from, I think we saw people that administer these types of funds, federal, other federal funds. So great mix in the room. And I think that's what they wanted to see. The local elected officials and the board members asked and said, let's hit the pause button, take this opportunity after 4 years to cast a wide net and see what the interest is and educate those who are interested and see what happens, right? Sometimes an injection of fresh blood into the system is good. Sometimes just having competition is good, right? When I got to sharpen up my pencil and make sure that I'm bringing great value to the community for this investment that we make, all of us as taxpayers. I want you to know that from a board perspective, we have a really good board members now that bring their subject matter expertise and are really challenging the staff to not only try to measure tangibly the return on investment we get for these funds, but also improve, if you will, push it up. But you raise the performance of the system. And again, it's not just us, it's with that context of our $18 million together with all the rest go over $100 million. So I think that's really, really important to note as you write these RFPs, return on investment, and may it be measurable. How are we doing? I have another online. Okay. Go ahead, Vicki. Faith, you're getting your steps in today.
I know I am. I'm going to win the Fitbit challenge.
Is the one-stop operator coordinating also the Job Connect offices?
Oh, that's a great question. So our system is in a process of evolution, right? And so is the whole nation, by the way. Every time I travel and see my peers in every state, municipality, region. This thing is done slightly different everywhere. I think that's both the beauty and the curse of this legislation, that they left it so that states like Texas and Florida, there's the state legislators there said, we're going to take this law and we're going to have this legislation at the state level that really neatly wraps everything together and leaves little to chance. And when it gets down to this level, it is prescriptive. There's not a lot of effort that has to be made to braid them all together and kind of, it's kind of forced or mandated. And other places like us, we have to willfully, if you will, politely come together and try to work out. And so that's where we are now. We're more than ever, we are working to really identify the opportunities to avoid duplication and raise the effectiveness of the services by working together. And so the Job Connect offices, the 3 of them, along with the TANF office on Belrose, were designated by our board and our LEOs as affiliated one-stop centers last year, I believe. And so while they're part of the network, they are not being currently operated by our operator. They're being operated by Dieter and the Department of Health and Human Services separately. But the operator does, and in their scope of work, calls upon to create the linkages and the referral systems and the cooperation between those centers and the ones that our operator does operate. I know that's a long answer, but it was kind of complex. I could have said no, right? But it's only 10:10, so I'm trying to fill in this one.
So this question, becoming a recipient of funds will mean becoming a partner of the one-stop delivery system?
Yes. Short answer is yes. Terms are thrown around, again, across the nation. We commonly refer to anybody who's funded with these funds as a funded partner. The legislation calls it service providers. I think it also calls it at some point sub-recipients. So the terms really, are not the most important thing. I think the most important thing is what you've heard today. What is the money for? To help people do the things you heard today. So that's the main thing, getting people either into the workforce or up that workforce ladder. That's the simplest way to, you know, and what I mean by that is, and again, the people that need the help, right? Because a lot of times, some of us are fortunate that we didn't need it, but some people have some barriers in their life that they really need help with. And again, there are many, right? And you can, over the next few steps, you'll learn more about those. But that's what the money's for. And then, so then I think today was, okay, well, what does it take to apply? And today you've heard some of that. And more importantly, if I get the funds, what's expected of me, right? If I get the funds, you're expected to meet the promises you made to help these people. And so, of course, needless to say, if that doesn't happen, then the services don't continue. The feds do not want to continue to serve or to fund an agency that's not meeting those requirements. And so, did I go off topic? Yeah, the partner. Yes. So that, go ahead. Was there more?
She wanted to know, describe that partnership.
Okay. So yeah, so the word partner, I think, is a good word. And when it says, I would say yes also, it's not just a partner when you receive funds from us. If you're awarded one of these contracts, you're not just a partner of Workforce Connections. You become a partner of all those other people in that system that you saw, because that's who you're expected to work with. Again, and there's another agency, in this case, the one-stop operator, that helps with that coordination, because as a Title I service provider, you're meeting customers, or your staff is meeting customers. And so you get some help from that one-stop operator to see how your services can align with that of the other service providers, Titles 2, 3, 4, and so forth. So you get some help there in that.